I'm Dr. Jessica Morgan. I'm a family practice physician with High Lakes Healthcare, a family practice group with Praxis Health. And I see patients 3 days a week, and I'm also a medical director for Praxis Health. So the community has supported us in Best of Central Oregon because they see the team approach that we have both in the clinics when they're being seen as patients. We work well together as a team, but also behind the scenes. Our administration and providers work well together, collaborating on healthcare and healthcare delivery. In the beginning, we felt like we were shutting down initially. It was a very scary time. We weren't sure how we were going to accommodate our patients, but we quickly adapted and were able to get telemedicine platforms up and running. And so we were able to, initially we were triaging patients just on the phone, giving them directions on how to care for themselves at home, conservative measures, but trying to keep them out of the clinics initially until we knew how to keep them safe. And then I remember the day that we got the telemedicine platform up and we said, let's turn on patient visits. And so we just started offering appointments. And I wasn't sure if we could, how that was going to be as a primary care physician. I have always been apprehensive of doing telemedicine. And we actually made it work, and patients were great. They were amenable to the new platforms. They just wanted access to their physicians. So we are able to triage patients that call in with either exposure or illness symptoms consistent with COVID. And based on a triage platform that we've designed, we route patients to the appropriate place of care. If they are appropriate for telemedicine, we'll do that in our primary care clinics. If they require an evaluation, we can do parking lot visits through our urgent care and also at our primary care clinic. If they had severe symptoms that we were worried about, we would triage them directly to the emergency room. It has been a roller coaster. We had to become accustomed to change, and that was difficult. But we quickly formed a team, a small group of us between administration and providers. And I think we worked really well together. When you have a small team that trusts each other, it's pretty easy to change quickly and efficiently. And I think that's what made it successful this last year. Well, it's changing, so what I say today will probably be different in a couple days. We're at a critical time right now. We've had successes. We definitely have great vaccination rates starting. We need to keep the momentum going. They have plateaued. The vaccines are a great layer of armor for us to fight against this virus, but we probably need to, at this point, continue with masking and social distancing because the Delta variant is very contagious and it is starting to, well, it has increased cases, and we're seeing, again, the hospitals being full, the emergency rooms being full, and access for care is again getting difficult. I think a lot of people are feeling burnout at all levels, and we're trying really hard to be cognizant of that. Of course, our providers and care teams are feeling burnout from the ongoing pandemic, and every time we seem to take a step forward, we might take 2 steps back. But we also see it at our triage level, at our phone systems, at our front desk, at our administration level. There is evidence of burnout across all levels of the healthcare system right now. I want them to feel safe coming to work, but I also want them to feel comfortable and welcomed and being able to be the staff that they want to be. I want them to be able to feel comfortable so they can be welcoming to our patients. And I guess I want them to feel secure in their jobs, both for physical health, but also it's a welcoming place and a nice, fun culture to work in.